If you've been dealing with lower back pain, maybe it comes and it goes, or maybe it's gotten bad enough where you're taking time off or avoiding work or your workouts. Well, you're probably not alone, right? The truth is that lower back pain isn't the problem. It's actually the symptom. And that's why so many treatments don't last. My name is Dr. Simeone. I'm the founder of the Disc Chiropractic located in Wheat Ridge. Today, I want to show you what really happens inside your spine and why it keeps flaring up, why your back pain keeps flaring up, and how you can fix it naturally before it gets any worse. Now, lower back pain, it can come from a lot of different sources, and that's exactly why it's so important to get a proper diagnosis before you begin treating. Now, some people, their pain comes from their disc, and that's this area right here. Things like a disc bulge or a disc herniation or disc degeneration. Whereas other people, they've got a problem in their facet joint, which is back here. And these little hinges in the back of the spine that help you bend and twist. And this is what creates the direction of that bending, twisting. And for other people, sometimes the pain is muscular. These muscles that will attach right here and here, as well as here and here. And that can cause things like trigger points and muscle spasms. But no matter where the pain is actually starting from, it's always a mechanical problem. And that means that it needs a mechanical correction. There's no chemical that can make a mechanical correction. Things like medication, ice, or heat, they can help with the symptom temporarily, but they won't actually fix how your spine moves and how your spine functions. You can think about it like this. The spine, it works a lot like a suspension system in your car, right? If one part of the suspension is out of alignment, you can keep driving and maybe even smooth things out temporarily with better tires or a quick tune-up. But the problem's still there, right? It's deep and it's underneath everything that you're, driving. And until you actually realign the suspension and restore balance, the wear and tear will continue to build. And your spine is really the same way. You can ice it, you can stretch it, you can take something for the pain, like a medication or a muscle relaxer. But unless you actually correct how it's moving and how it's functioning, it's only a matter of time before it'll flare up again. And that's why when you feel, sharp pain, whether it's burning, shooting, it might even be numbness or tingling. Now, muscle pain, on one hand, it's usually more dull, tight, and achy. And that's because the body is creating this tightness to actually protect itself. But over time, those spasms can turn into trigger points, and that will keep the pain cycle going on and on and on. Now, when you look at your x-rays, there are three main things that we want to see when we're looking at them from the side. Let me show you what exactly that is. So from the side, you want to see a nice backwards curve in the neck, a forward curve in the mid back, and then a backwards curve in the lower back. And that's because those curves, they act like the arch of a bridge, right? And that gives the spine strength to adapt to the day-to-day stresses of life. The second thing that you want to see would be full and level spaces between the bones, and that's the disc. And this disc, it acts like a spacer to create the hole for the nerve to exit right there. And the third thing that you want to see are squared edges around all of the bones. And the reason why is that's what normal looks like. And if these edges begin to deform, that's osteoarthritis. And that occurs when those parts of the spine are under stress. Now, What we do is we use a motion x-ray and we use an analysis called a penning analysis to see which bones are moving when you move and which ones are stuck. And those stuck joints are the real problem. That's the mechanical issue that needs to be corrected. And once you restore motion, that pressure will be relieved from the nerve, the muscles will relax, and your body will begin to heal. So the goal isn't just to make you feel better in a week, it's really to restore proper function and proper movement so that your spine can do what it's meant to. It can function and move the way that it was designed to. And when you fix the cause, then you stop chasing the symptoms. Now, the problem is that most traditional treatments, they never really look um, at the mechanical issues. Most of them are treating the pain and not the actual pattern, the movement pattern. And that's why so many people stay stuck and the cycles just, they return over and over again with these multiple flare-ups. Now, it's very common for people to start using ice, or they rest, or they use painkillers. Maybe they do some stretching and some massage. They might feel better for a few days, but that pain oftentimes returns when they're doing something as benign as lifting groceries or cleaning their house. And those methods, they are really chasing the symptom and they're not uh, addressing the structure and the movement of the spine. So it's not that you failed your treatment, it's that the treatment itself actually failed you. Now, at the Disc Chiropractic, we start with clarity by using our digital and motion x-rays. Again, we perform a penning analysis to measure the movement and identify instability. Rather than just guessing, we're measuring. Then we build a treatment recommendation or treatment plan that usually has a combination of precise chiropractic adjustments to restore the alignment of the spine as well as restore the function and the movement of the joints. Oftentimes, we're using spinal decompression therapy for individuals who have disc injuries that are compressing the nerves. And we do that to basically pull in healthy fluid into the disc to unpinch the nerve, decompress the spine, and relieve that pinching. We also use therapeutic exercises to help strengthen and stabilize the spine so that the pain stays away. And if there are soft tissue injuries present, then we also use things like therapies like shockwave therapy to increase the blood flow to the soft tissues, stimulate stem cell production, and accelerate the healing process. Now, I do want to share with you a story about a 57-year-old patient who came into our office following a car accident. Uh, she's a house cleaner, and so her job requires her to constantly be bending and lifting and twisting. Now, since that accident, she had severe tightness and pain in her lower back, and she stated that was reaching an 8 out of 10 for most days. She had tried things like ice, heat, Tylenol, and stretching, but instead of improving, her pain kept getting worse and worse and worse. Now, when she came into the office, we discovered that she had multiple restrictions in her lumbar spine, as well as compressed disc spaces from that impact. And after a series of chiropractic treatment, decompression therapy, and stability exercises, she was able to regain her function, relieve her pain until she's completely pain-free today. Now, she's able to get back to work fully without any restrictions. She's able to bend, twist, and move comfortably again. And so seeing someone go from being in pain and fear of re-injury is really what it's all about for us. So back pain, again, it's really your body's early warning sign that the joints and the discs are under stress. And if you ignore that sign, then those joints will degenerate and disc discs can dehydrate, making recovery much, much slower. And the earlier that you're able to restore that motion and the circulation, the faster that your body's able to heal. And if the pain is increasing in intensity like hers was, then now is the time to act and to get ahead of it. So, if you're ready to find the real cause of your lower back pain, we're offering an opportunity to get quality information about your health. That way you can make a quality decision about what to do about it, whether it is with us or with somebody else. So, in our office, we're offering a new patient consultation, exam, any necessary x-rays, as well as a personal report of your health findings for only $47. You'll get to see the motion x-rays of what's working and what's not working. We'll go over orthopedic tests. And again, you'll get a report of exactly what's going on and an opportunity to ask questions. That way you can understand what's happening inside of your spine. Now, again, the longer that any joint or disc stays compressed, the harder that it becomes to actually reverse that stress and degeneration. So taking action now can change your outcome. And it is as simple as clicking the button that you'll see on your screen or giving us a phone call at 720-573-4910. So again, like I mentioned, whether it's our office or another, I hope that this information helped you understand that back pain is something that you can fix when you understand what the cause is and you treat the cause itself rather than covering it up by addressing the symptom. Because your spine is living, it is adaptable, and it can heal when you restore alignment, movement, and hydration to the discs. So again, I'm Dr. Al Simeone with the Disc Chiropractic. I appreciate you taking this time to watch this video, and I hope that it gives you some valuable information. And I do hope to see you at the next perfect time.